My speech is on HIV discrimination. HIV-related stigma and discrimination refers to the prejudice, negative attitudes, and abuse that's directed at people that are living with AIDS or HIV. Stigma and discrimination also makes people vulnerable to HIV. Those most at risk to HIV continue to practice stigma and discrimination based on their actual or perceived health status, race, socioeconomic status, age, sex, sexual orientation, gender identity, or other grounds. Stigma and discrimination manifests itself in many ways. Discrimination and other human rights violations may occur in healthcare settings, barring people from accessing health services or receiving quality care. Some people living with HIV are shunned by family members, peers, and people in the community, while others face poor treatment in educational and work settings, erosion of their rights, and psychological damage. These all limit access to HIV testing, treatment, and other HIV services. The fear surrounding the emerging HIV epidemic in the 1980s still persists today. At that time, very little was known about how HIV is transmitted, and it made people scared of those that were infected for fear of contracting it themselves. This fear, coupled with many other reasons, means that lots of people falsely believed that HIV and AIDS were always associated with death, and that HIV was also associated with behaviors that people disapproved of, such as homosexuality. Or even, some believed that HIV infection was the result of personal irresponsibility or moral fault, and that they deserved to be punished. One study found that some participants who reported high levels of stigma were over 4 times more likely to report poor access to good health care. This contributes to the expansion of the global HIV epidemic and a higher number of AIDS-related deaths. An unwillingness to take an HIV test meant that more people were diagnosed late when the virus may have already spread and progressed to AIDS. This makes treatments a lot less effective, increasing the likelihood of transmitting it to others and causing early death. Fear of a negative community reaction can also hinder the efforts to address the HIV epidemic by continuing the silence and shame that surround the virus. Negative self-judgment resulting in shame, worthlessness, and blame represents an important but neglected aspect of living with HIV. Self-stigma affected a person's ability to live positively, limits meaningful self-agency, quality of life, adherence to treatment, and access to quality health services. Healthcare professionals can medically assist someone infected or affected by HIV. They can also provide life-saving information on how to prevent it. However, HIV-related discrimination in healthcare still remains an issue, and it's particularly prevalent in some countries more than others. It can take many forms, including mandatory HIV testing with or without a person's consent, and without appropriate counseling. Health providers may minimize contact with you or the care of the patients living with HIV. They may delay or deny treatment, demand additional payment for services, or isolate the people that are living with HIV from other patients. In the workplace, people living with HIV may suffer stigma from their co-workers and employers, such as social isolation or ridicule, or experience discrimination practices, and may even lose their job and suffer termination or refusal of employment. Community-level stigma and discrimination towards people living with HIV can force some people to leave their home and change their daily activities. Ultimately, adopting a human rights approach to HIV and AIDS is in the public's best interest. Stigma blocks access to HIV testing and the treatment services, making transmission even more likely. Education on the subject is the key. The removal of barriers to the services is the best way to end the global HIV epidemic.